Have you ever wondered why your toes are curling under? Have you thought about different ways you could treat it? Can it be treated? Keep watching for answers. Welcome to Suite 250 at Cool Springs Foot Care. My name is Dr. Lance Reeves, and today we're going to talk about hammertoes. A hammertoe is a combination of deformities that involves metatarsal phalangeal joint dorsiflexion, proximal interphalangeal joint plantar flexion, and distal interphalangeal joint dorsiflexion. That's a lot of big words, and I went to school for a long time to figure that out. Hammertoes can be caused by a lot of different factors. Again, genetics can play a role in this, meaning if mom or dad had a hammertoe, there's a good chance that you may have a hammertoe as well. So you can say thanks mom and dad for the genes, or in this case, the hammertoes as well. There are other things that can contribute to a hammertoe. This could be a flat arch, a high arch, or if your long flexor or extensor tendon gains mechanical advantage over some of your intrinsic musculature. Certain diseases such as diabetes, rheumatoid arthritis, or Charcot-Marie tooth can actually predispose someone to hammertoes as well. Clinically, there are several complaints patients come in with. A lot of times this is from a painful lesion on this toe, getting irritated by shoe gear. Sometimes just the contracture of that toe can lead to a painful pressure point on the toe while patients are walking. A lot of times there are multiple pathologies associated with this hammertoe, which means a patient could have a painful bunion, they could have painful metatarsalgia, or sometimes nerve entrapment can all be signs and symptoms associated with that painful hammertoe. That's why it's important to get a full comprehensive exam when determining what all is going on around or with that hammertoe. When looking at a patient's hammertoe, it's really important to get x-rays. My rationale is that it's not always just the hammertoe. There could be multiple things contributing to that. Getting an x-ray allows me to see the entire picture and talk through everything that may or may not be going on with that patient's foot. And in this case, when I'm evaluating the x-rays, I'm looking at every different deformity, every different angle of measurement to determine what exactly is the cause or what's contributing to some of the patient's pain points. When starting to think about different treatment options, conservatively is always the first initial route to see if I can do something to get that patient away from needing surgery. But in some cases, if patients have been dealing with this for a long time and they've failed some conservative measures, surgery might be indicated sooner rather than later. But for me, patients ultimately have the final decision in their treatment plan. If they want to do everything they can conservatively, I'm happy to help them with that. If they want to jump to surgery, and I think that's a good indication for them, I'm happy to do that as well. First, let's talk about conservative measures. Again, meaning something that we can do for the patient to help make them better without getting into surgery. For hammertoes, this can be as simple as a toe spacer. That spacer can go in between the toes and hopefully prevent some friction or rubbing between those toes. Other times this can be a toe sleeve, meaning this goes around the toe and can pad certain areas that are causing them pain. There are even specific pads or sleeves for hammertoes that are made to help straighten the toe and take out some of those contractures. My experience with some of these different conservative treatment modalities are pretty hit and miss, meaning some patients do really well and it works great. Other patients don't do so well and generally want to talk about different options. Again, I'm happy to work with you in whatever realm you're looking to go as far as treatment for this hammertoe, but I don't see much gray area. It's usually the conservative works really well, or it just doesn't for patients. Surgical options exist in a few different forms for hammertoes. My specialty is in minimally invasive hammertoe correction. This means you have tiny 2 to 3 millimeter incisions versus your bigger 2 to 3 inch incisions. This can involve some bone cuts or tendon lengthening to try to take away those deformities and make your toes look more natural. What's unique about this technique that I use is there is no hardware or pin sticking out of your toe. A lot of people tend to cut out the joint and they'll stick a pin in that toe for 6 to 8 weeks to hold it in position. My goal with surgery is to preserve the joints in the toe. Whenever I'm doing hammertoe correction, my goal is not to give you a rigid straight toe, but a nice natural looking toe. The way that I make this correction allows for external splinting or taping after the procedure, and this holds your correction throughout the postoperative course. What's also unique about this is it allows patients to walk immediately after surgery. There's no crutches, no knee scooters, no wheelchairs. Patients are walking same day of the procedure. It is important to note that minimally invasive surgery is not conducive to all treatment pathologies, so it's important to seek medical counsel to see if you are a good candidate for that type of procedure. Again, ultimately my goal for you is to get the best treatment and care possible. That means if you want to avoid surgery at all costs, I'm in. I'm willing to help you do that for as long as you want. If you're looking to get surgery right away and I feel you're a good candidate, then let's do that and get you better, because it could be a really good option for you. If you have any questions or concerns about Hammertoes, you can always call the office at 615-567-5622, or you can visit us online at www.coolspringsfootcare.com. Thanks so much for watching this channel. If you found it helpful, please like, comment, and subscribe to our channel.